Hey y'all, I've got Laura here with me today. We're doing her second EBOO treatment and starting to see a little bit of progress, and want to talk about some of the things that you can expect when you're having EBOO depending on what your body may be battling. So for some people, especially athletic performance people or people who live really clean diet lifestyle, they can walk out of here feeling energetic and just kind of like, man, I feel awesome. The majority of people don't really feel anything right away, or they'll feel more tired and you just kind of get a little bit fatigued. So that kind of was your situation, wasn't it?
Right, yeah.
Yeah.
I felt a little more fatigued afterwards for a couple of days, and then had a little spurt of energy, and then kind of more fatigue again.
Yeah, more fatigue again. And then was there a difference between your 03 UVIB, which we did first, and your EBOO treatment?
Yeah, I would say I felt probably more energetic after the
03?
first 03. But I've had more clarity after the EBOO treatment.
Okay.
More fatigue, but also more clarity. And some other changes that I realized that things are improving.
Yeah.
So,
like what?
So my skin was super bright and glowy. Like, I got up one morning, I was like, wow, why does my skin look so
Dang,
great?
I'm looking good.
I look like I just had a facial. So that was great. Definitely the brain fog has been a humongous improvement. I guess I didn't even realize how bad of a problem it was until we had to talk about it. And then I was like, yeah, I really am really foggy.
Yeah.
And then when I came out of it, it was, even my husband was surprised. Like, I can't believe that you could remember this actor's name when we're watching a movie, or silly things like that. But
yeah,
my mind just feels so much more clear.
Good.
So that's been
awesome.
great.
We're also doing, in addition to the EBOO, we're doing nasal insufflation and ear insufflation, because really the biggest reasons that you came to me in the beginning was your face hurts so bad.
Yes.
Just chronic sinusitis, infections, pressure in her face. And so that was the reason that she wanted to have EBOO. And so we started, we did some nasal insufflation, but now that we're really got EBOO and nasal insufflation, tell me how that's changed.
That's been amazing. And yeah, that was the whole thing that started this all. I watched a video of you helping a gentleman with the sinuses, and I was like, yes, please. I've had sinus problems probably all my life, but they've been really bad the last couple of years. I live in the country, and there's always something different growing in a field nearby, and allergies and sinuses have been horrible. So it seems like as soon as I get over a sinus infection, then I get another one again.
Yeah.
And my face was in so much pain, like I was willing to try anything.
Sure.
So I'd watched your YouTube video, and I was like, yes, I need that.
Yeah.
So I immediately felt relief, and then it just continued to get better, and I haven't had any sinus pain whatsoever since we started doing that.
That is awesome.
Yeah, I love that. That's been
great. I'm so excited. Like the primary goal of treatment, check, done. Yep. And now we're adding on other things, some things that you didn't know you needed.
Exactly.
And other things that'll get better. And when you have chronic sinusitis, or you have chronic bronchitis, or you have chronic inflammation that has caused you to need antibiotics over and over and over again, it messes so much with your gut health and the good bacteria in your stomach. And so when you have that dysbiosis, that difficulty of good, healthy balance of bacteria in the gut, that your gut is your biggest immune support, and it produces hormones, and it produces chemical transmitters that help with your brain and your state of mind. So gut health is important for anxiety, depression, immune health, fatigue, weight gain. All of those things come because of poor gut health. So if we can kind of start to get to the root cause of, she needs to be on antibiotics because of the repeat sinusitis, then we can back away from this continually re-injuring the gut out of a need because of the sinus infections. Then other things will fall in line. So we're working on that. We're taking care of the gut, and things are just kind of starting to fall into place a little bit.
Yeah,
Yeah.
definitely.
Yeah, good deal. Last thing I want to show you guys, very common, usually with the second or third EBOO treatment, super common to have an excess of foam coming out of your canister, your collection canister. And so I'm just going to take this and kind of show you.
Yes, we're having a foam party.
We're having
today.
a foam party, y'all.
Party.
Party up at Mojo Med. Okay, so here's the collection container. Kind of hard to, let's see, have I got it? There we go. So this comes down from the ozone filter. The blood and the ozone meet each other in there, and there are particulates that the ozone will kind of die off and kill off in the blood there. And so they've done tests on this fluid in the past, and they find that a lot of times the foam is uric acid that your body's getting off. And uric acid is inflammation, obviously. Gout, people who really struggle with gout and pain in their joints, the uric acid is the biggest cause of that. People are usually really afraid to go off of like their allopurinol and other medications because gout is so painful. So when we are helping the body to get rid of a lot of this uric acid, which is a byproduct of sugar and other inflammatory factors in the body, then this is, you could basically say like this is inflammation leaving the body, which is really exciting. So anyway, just wanted to give you a peek into another EBOO session and a real life person. And I appreciate your feedback and talking about it and other stuff.
I'm glad you're here to help people like me identify problems that we didn't even know that somebody knew about.
Yeah.
I remember telling you that like I'm crying the first time that I came in here. Like I'm so happy that somebody finally listens to what's happening with my body and can explain why it's happening, and now you can fix it.
Yeah.
So.
And do you mind if we say like you're also, so we're also taking care of Laura with her perimenopausal symptoms. So we're starting some bioidentical hormone therapy and really kind of helping to bring back, if you're exhausted, you're tired, you're irritable, you're cranky, you have anxiety, depression, your body hurts, it's hard to get out of bed in the morning, your brain is foggy, you're kind of struggling to put the thoughts together, or your sleep is horrible, or your intimate life, you have no sex drive, or when you go to have sex it's not as pleasurable, or you have, for women, vaginal dryness, for men, erectile dysfunction, all of those things, they really do start in our mid-30s for women, and just kind of continue on as it only gets worse from there, they say. But you know what, y'all? Menopause does not need to be miserable. It does not. The perimenopausal period where you're up and down and all over the place, it does not need to be miserable. So we're kind of bringing a little bit of life back.
Yeah, definitely.
And I'm going to restore some energy and some good happy hormones. And so anyway, that's what we're doing. Just wanted to kind of bring you guys in, take a little snapshot picture, and next time we'll do another update, and we'll see how you did after the next one.
Great,
So,
thank you.
Thanks, y'all.
Excited to get my mojo back.
Yeah, she's getting her mojo back. Yeah, you are.